This year, more than ever, many of us are starting the new year with weight concerns. Fact is, this pandemic has been hard on our waistlines. I spoke earlier with Dr. John Tan, bariatric surgeon with HCA Midwest Health, to learn some of the more innovative solutions.
As a metabolic and bariatric surgeon, I cover the full spectrum of how we help people with metabolic disease. And metabolic disease, the biggest side effect is being overweight or seeing that excess weight on someone. And we start with things like medications, diet, exercise, lifestyle modifications, intermittent fasting. But we also do about 7 to 8 different procedures for weight loss, varying from things like gastric balloons and endoscopic sleeves all the way up through gastric bypass, gastric sleeve, and the duodenal switch.
So let's talk about some of those procedures. What one are maybe you using the most these days, or what are the most exciting that you're seeing results from?
So the most common bariatric procedure in the United States is the gastric sleeve, and that's for someone with a more moderate to mild disease. We have things like the gastric bypass, which has been around for 50 years and is tried and true to help cure diabetes and fix gastric reflux as well as their metabolic disease. But some of the most exciting ones are for people with the more mild disease that haven't been able to qualify for insurance yet, and we can do an endoscopic sleeve just through the mouth and suture up the inside of the stomach without ever doing an actual surgery where we're going through their abdomen, and we're seeing great results with that as well.
Can you just kind of in layman's terms explain what that sleeve does?
Right. So if you can imagine kind of gathering up the stomach and suturing it all to itself so it heals to itself from the inside. And we do that just through the mouth, so no incisions at all. And that's for someone with a more mild disease, someone with a lower BMI, maybe somewhere in the 30s. So they've been struggling, they work out all the time, they diet constantly, and they just can't see that weight come off because their metabolism is against them. It's, we all have those friends that are super skinny, eat whatever they want, try to gain weight, and never exercise. Well, it's just like that for people with metabolic disease. They diet all the time, they exercise all the time, and their body just won't lose weight. And if they can go through extreme measures, then their body just goes right back to it the minute they let off those extreme measures. That just go, it's like a temperature. Our body's temperature is 98.6 degrees. Our body's metabolism also has a set point. Everybody's different. And no matter what we try, it wants to come back to that area.
Yeah, it is just so frustrating. And it's so exciting to hear that there are some options for those so frustrated with that. I've heard a lot about telehealth in this pandemic. Is this something that you can help someone with via telemedicine?
My last patient lives in Omaha, Nebraska. So, and we just did a new patient visit, and we don't have to have someone nearby. It's something that we do quite well. I mean, this is a testimony to that right now. We're having a WebEx discussion. We don't have to be in person. I do quite a bit through telehealth.
So for more from HCA Health, just go to kctv5.com/HCA Midwest.